So I spend a lot of my time doing chemoprevention, clinical care and research, and really what chemoprevention is taking a medication, being a healthy person, taking a medication to help reduce their future risk of breast cancer. Many people think that the only people who really should be thinking about this are those with a strong family history or those who have gone for genetic counseling and been found to carry a breast cancer mutation such as BRCA1 or 2. But the reality is that the studies that looked at tamoxifen or exemestane or other medications to prevent breast cancer, the intended audience was really a broad population of women who are deemed to be at increased risk, perhaps based on their family history, but those who may have had a breast biopsy that showed atypical cells in the breast. In fact, one of the original studies really included women who were 60 years of age or older, and that was it. That's all they had to do to qualify for those studies. We're learning now, in fact, there was an abstract presentation even today, that by taking 5 years of a prevention medication, specifically tamoxifen, it continues to protect a woman from breast cancer even 20 years out from the time she took the medication. These medications do appear to reduce the risk by a third to up to a half, which is a substantial decrease if you multiply that over thousands and thousands of women who could potentially take these medications. I think where we lose people is the side effect profile. So I could say, this is fantastic, this drug reduces your risk significantly, but when I start talking about the side effects of the pill, hot flashes, night sweats, leg cramps, a small risk of uterine cancer, a small risk of blood clots, the list goes on and on, that's where I lose a lot of potential patients who may otherwise have been willing to take the medication. I think part of winning that battle and trying to basically sell these drugs to women, I think would come from better identification of women who really truly are at increased risk of cancer. They may be more willing to put up with side effects if they believe that their risk is higher, or we can show them that their risk is higher. I think we do need to spend time using the medications that we've proven to work, but I do think research needs to go in the direction of finding something with fewer side effects that could be applied to the masses, if you will. Somebody might be more willing to take what we call a nutraceutical or a vitamin or some herbal supplement, something with fewer side effects. If most women would take it, perhaps that would translate to thousands of fewer breast cancers if you spread it over the population.